Buenos días, buenas tardes. Thank you, everyone. Okay, so since that we have a large number already in the room, so we're going to get started to be respectful of everyone's time. So hello, everyone. In the name of the National Latino Behavioral Health Association and the National Hispanic and Latino Addiction and Prevention Technology Transfer Centers, we welcome you. My name is Ana Chavez Mancias. I am the co-director for the National Hispanic and Latino Addiction Technology Transfer Center. Welcome to the first session of a two-part series titled Understanding Risk and Cultural Factors Contributing to Substance Use in Hispanic Latino Immigrant Youth. I will be your host for today's presentation. Next slide, please. Before we introduce our amazing presenter, here are some brief instructions about our event. Here is the information about our grant. You will receive a copy of this presentation so you can read the content at your own convenience. Next slide. This session will be recorded and archived for future playback. A copy of today's presentation will also be made available. The lines will be muted throughout the presentation to minimize background noise. When we get to the Q&A portion of our webinar, you will have an opportunity to ask questions by clicking the Q&A box, and we will share your questions with our presenter. We will also be asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work that we do and provides us with the opportunity to improve our training efforts. A certificate of completion will be sent via email at the end of the webinar. And closed captioning is available for this event. You need to activate your screen by clicking the live transcript button at the bottom of your screen, then choose to show subtitles. Next slide, please. We would like to take a moment to reflect on the power of words and remind you that together we can use our words to create positive change. Next slide, please. Here is the TTC network map with information about the Addiction Prevention and Mental Health Technology Transfer Centers. Each network is comprised of 10 regional centers and 3 national centers. The network coordinating offices, National American Indian and Alaskan Native TTCs, and the National Hispanic and Latino TTCs. Our centers has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Next slide, please. Please allow us to introduce you to our parent organization, the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit and is located in New Mexico with the mission to influence national behavioral health policy, eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino populations. Next slide, please. NALBA's objectives is to provide national leadership on mental health and substance abuse concerns of the Latino community. NALBA's policy priorities include selected capacity, expansion of mental health service for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of behavioral health professionals, funding for co-occurring disorders of alcohol and substance abuse, opioid crisis in the Latino community, and suicide prevention. Next slide, please. Our team is staffed by Dr. Susie Villalobos, serving as the project director for both centers. I am the co-director for the National and Hispanic and Latino ATTC. For the PTTC, we have, again, Dr. Susie Villalobos as the project director, Priscilla Jamesi as project coordinator, and Cristina Mancibo Torres as program specialist. Next slide, please. Now it's time to introduce our amazing presenter, Dr. Richard Cervantes. is Research Director of Behavioral Assessment, Inc. Dr. Cervantes was a research psychologist at UCLA, a Spanish-speaking mental health research center, and held a full-time faculty appointment in the USC School of Medicine, Department of Psychiatry and Behavioral Sciences. Dr. Cervantes is co-investigator at the Duke University, NIH-supported Hispano, a study on acculturation stress and biomarkers. He was also the principal investigator for the NIH-funded study development of the Hispanic stress inventory 2 and PI on the recently completed the NIH drug prevention study Familia Adelante, a multi-risk prevention program for Hispanic youth. Dr. Cervantes is also a leader in evaluation science with a special expertise in cultural competency and cross-cultural instrument development. He is the lead evaluator for the SAMHSA, Hispanic and Latino Addiction Prevention Technology Transfer Centers, TTCs. He has published extensively in peer-reviewed journals, books, and special reports. He is on the editorial board for the Hispanic Journal of Behavioral Health Sciences and sits on a number of national, local, and university-based advisory boards. Dr. Cervantes received his PhD in clinical psychology from Oklahoma State University. Dr. Cervantes, thank you for your availability to share your knowledge and your experience with us. Please feel free to start your presentation.
Thank you, Ana. And on behalf of the National Hispanic and Latino ATTC and National Hispanic and Latino PTTC, as well as the National Latino Behavioral Health Association and our organization, Behavioral Assessment, I wish to welcome all of you to this hopefully fruitful presentation, virtual learning series. Today's topic, early identification of pre- and post-migration risk factors of substance use disorder in Hispanic and Latino youth. We'll be covering a wide range of materials and topics today. It was kind of hard to pare down the topic in terms of the amount of material that I'd like to provide you and not to overwhelm the participants at the same time, to really go into some detail on what are the risk and protective factors that contribute to substance use in Hispanic and Latino youth. You're going to see a very heavy emphasis on issues around stress and trauma, because we believe that is critical for our youth, for Latino youth, especially those who are recent immigrants or recent arrivals to the United States, many of whom are unaccompanied minors or are living in unfamiliar homes. So with all that said, we have a lot to cover. I'm going to go right into it. We will have some time at the end for questions and answers. Please feel free to post any of those in the chat box, and we will try to get to all of your Q&As at the end. So again, my pleasure to be here with you this afternoon or this morning. In my case, I'm coming to you from Los Angeles on the West Coast. So welcome to all of you. Let's go to the next slide. Next slide. So just a little background. I'm sure most of you are more experts than I am in some of these data and some of this information, but just as a summary, Latinos are expected to reach over a quarter of the US population by 2060, and we have the fastest growing adolescent population. The majority of our Latino children under 18, that's about 52%, are US born to foreign born parents, most commonly from Mexico. So over 3 million second generation Latino children are constantly threatened indirectly by deportation policies because they have at least one parent that is unauthorized to work in the United States. We call these mixed status families. So you kind of get a picture of at least half of our youth and their circumstances in terms of legal status for their parents. Again, as I mentioned to you, there are many new arrivals and many unaccompanied youth that are not really included in this data. But for sake of today's purposes, let's just say we have a lot of immigrant or mixed immigrant families. Let's go to the next slide. So interestingly, Latino immigrants in the US are healthier than their US-born Latino and non-Latino counterparts. Again, I'll repeat that. Latino immigrants are healthier, right, when they come to the US, but this, what we call health advantage, it diminishes over time with higher levels of acculturation. Now, acculturation is that process of changing one's culture, your values, customs, belief system, language, all of that. We're going to talk about that in a few minutes. But that creates stress. So acculturative stress is the stress associated with being a Latino immigrant and acculturating in the US. It is a key driver of this decay in health. In fact, acculturative stress is the most robust predictor of things like substance use, intimate partner violence, HIV, and depression. And this is based on some recent research that we're conducting at Duke University. Let's go to the next slide. So let's talk a little bit about acculturative stress. This is kind of wordy, but important. So acculturative stress it's a stress experienced by immigrants in the US, not just Latino immigrants, but other immigrants. But for our purpose today, we're talking about Latino immigrants. It's a result of adapting to a new context and experiencing dissonance, like conflict between cultures. Acculturative stress results from societal forces shaped by racism, xenophobia, and differences in the culture of origin and the receiving communities. Many of you are immigrants, so you know what we're talking about when we talk about acculturation and stress. Conflicts may arise when differences exist in levels of acculturation between parents and kids, right? And difficulty with navigating the system in the US, such as healthcare and education, among others. So if you're talking about, for example, unaccompanied minors, newly arrived minors who may be placed with non-Latino families, you can see the acculturation issue is going to be pronounced. Finally, Latinos immigrants in the US South, that's where we're doing a lot of our work with immigrants, are disproportionately at risk for experiencing high and chronic levels of stress related to acculturation. And this is really related to very strict enforcement, like immigration policies, living in more recent immigrant receiving communities where systems like healthcare and education have not really been adapted to the unique needs of our immigrant population. So there's many structural issues, structural barriers for our families, especially in rural places like South Carolina. I saw some of you here from Washington State, Eastern Washington, Eastern Oregon, even places in California that are more rural. Let's go to the next slide. Just in terms of some other health disparities that are important, our population suffers more from diabetes. We have had problems with suicidal ideation and suicide attempts, especially among Latinas, young Latinas. We have had problems with increased or high binge drinking rates compared to other ethnic and racial groups. 1 in 6 Hispanic Latinos with HIV are unaware that they have it because we tend not to go to the doctor. We tend to not have health care coverage. We tend not to get regular checkups. And some studies have shown that even psychiatric disorders are high for Latinos, especially among Puerto Ricans. There's an increased rate of psychiatric disorders among US-born English language proficient and third-generation Latinos. that's what I meant earlier, what I mentioned about immigrants tend to come to this country. If immigrant families migrate together, tend to come to this country and are much healthier, both physically and mentally. But that health seems to deteriorate over time. Again, we think it's because of the acculturative stress that plays a major role in that. Let's go to the next slide. This is kind of a busy slide again, but basically showing in the big bubbles for the general population, 3.1 million people aged 18 and over had a substance use disorder. 3.3% of Latinos 18 and over had both a substance use and mental health problem. That's a co-occurring disorder. And among Hispanics, 16.9% of the total population had a mental health issue. And again, this is all based on the SAMHSA National Household Survey on Drug Use and Health. We're going to send these slides to you so you can study them more carefully. But the bottom line is our population, Latinos, have we're equally represented among those with a substance use disorder. We are equally represented among those with a mental health condition. One of the issues that we always talk about is that we don't go in for care. We do not go in for treatment. We do not access care. We're much less likely to have visited a psychologist, psychiatrist, social worker, or even a physician. And that's really pronounced in the immigrant population. So there are many issues around lack of access, lack of availability of Spanish-speaking providers that affect this lowered use of mental health and substance abuse services. Why am I saying this? Because you all, and I see there's well over 100 of you on this webinar, you are the front line. You are the ones that can, in fact, do these early assessments and get our people in for care. Next slide. So one of the things for kids, let's talk about kids because we want to focus on children today. But as I said earlier, according to these annual surveys, by the 12th grade, our students have pretty high rates of everything. 30-day use of marijuana inhalants, crack, cocaine, methamphetamine, and over-the-counter medicines, including vaping. So we are no different than other groups of kids. We have the same kinds of substance use problems. Again, as I mentioned to you, past studies have shown that Latino students have some of the highest rates of binge and heavy drinking. And that includes our immigrant kids. And this is kind of older data, but as I mentioned to you, even teen pregnancy is much higher among Latinas and young Latinos than in other ethnic and racial groups. So if you think about unprotected sex as a risk factor, we certainly are overrepresented in that area. Next slide. What we like to do is think about, and we're going to get to these questions. I see a question about comparisons between our country and other countries. What we like to do is to frame a lot of the substance use and mental health issues within a risk and protective factor framework. So there are many, many risk factors now that we know and they've been well studied that lead kids to substance use and other behavioral problems. We call these precursors or risk factors. So precursors can include things like alcohol, or I say precursors are the risk factors that are associated with higher probability of drug use, alcohol use, and even trauma and emotional problems. This risk factor approach, using a risk factor approach, we seek to prevent drug use and emotional problems by eliminating, reducing, or mitigating the risk factors. Many risk factors for drug use also predict other adolescent and childhood behavior problems. And this goes back to some of the early Hawkins and Catalano studies that for you older folks are more familiar with. But the research continues to accumulate. Next slide. And we're going to talk more about this for Latinos. So, these are well-known risk factors for substance use, family history of alcohol and parental use of alcohol, and sibling use of alcohol or drug use is probably the most powerful predictor that a youth will go on to use drugs. So they model what they see at home. Also, poor family management practices, family conflict, low bonding, low communication or low connection with families. So you can see, for example, in unaccompanied youth that are placed, in new homes, new housing or new home environments, those connections and bonds to that family have to be established quickly. Other risk factors, include academic failure, low bonding to schools, early peer rejection, alienation, rebelliousness, kids that have favorable attitudes towards drug use, or that are, that are early experimenters, they have early initiation. And there are other factors, including lack of social bonding to conventional societies, organizations that also predict substance use. So the lower kids are connected, the less kids are connected to traditional institutions like the school, the family, faith-based communities, even sports, after-school organizations. If they don't have those kinds of connections, they're a much greater risk for substance use. Next slide. Among Latinos, interestingly, with some of the research that's being done, acculturation-related risk. So remember I talked about acculturation. If there's an acculturation gap within the family, that has been shown to increase the risk for polysubstance use and binge drinking. Also, laws and norms that are favorable towards drug use and the availability of drugs. Many of you live in states where we now have recreational use of marijuana laws that have passed. But remember, those are for adults, not for youth. But at the same time, kids tend to be bombarded with positive messages about the benefits of marijuana use. While those may not be true, those are advertising. Kids buy into those messages. Also, extreme economic deprivation, neighborhood disorganization, early problems, behavioral problems, including aggressive behaviors in boys or other conduct problems and hyperactivity in childhood and adolescence. All of those are risk factors for later substance use. The one that we should key in on is the acculturation gaps, and I'm going to talk more about that in a minute. So when we talk about youth and we talk about acculturation stress or stress within the home, we like to rely on this sort of stress, illness, or stress and coping framework. It's a good framework for understanding mental health and substance abuse and the acculturation process. As I mentioned to you, acculturation itself can produce stressful life events that are associated with poor mental health, with substance use and alcohol use. The stress process for adolescents is influenced by multiple factors. And as I mentioned, they can include peer relationships, school and other responsibilities, family environment, and physical and psychological changes. Those are the kinds of stresses that most kids and adolescents have just as a general rule in terms of growing up, right? But when you add to that other things, other traumas, other kinds of stressors, and acculturation problems, as you see in the last bullet, the acculturation gaps among Hispanic youth in those families have been thought to be a key understanding to mental health, behavioral problems, and suicidality. One of the studies that we published looking at suicidal ideation among Latinos in a large national sample showed, in fact, that those kids that had suicidal ideation or an intent to harm themselves also had very high levels of family acculturation gaps, stress, as well as neighborhood gang and community violence kinds of stressors. Next slide. This is a wonderful resource, the National Childhood Trauma Network, National Childhood Traumatic Stress Network. Let me get that accurate, NCTSN. You can Google this. It's a federally funded traumatic network all around the country looking at children's traumatic stress. I thought it would be helpful to just kind of review when we talk about children and trauma, right? So what is a traumatic event? Traumatic event, again, within this context of stress, it is a frightening, dangerous, or violent event that poses a threat to a child's life or bodily integrity. Witnessing a traumatic event that threatens life or physical security of a loved one can also be traumatic. This is particularly important for younger children as their sense of safety depends on the perceived safety of their attachment figures. Now, you can automatically see when we're talking about children who live in mixed status families where there's a heavy presence of immigration enforcement, that constant fear that the parents are not, that their parents or caregivers are not safe, that can cause a lot of trauma in children. Children may feel terror, helpless, or fear, as well as psychological reactions such as heart pounding, vomiting, or even loss of bowel or bladder control. Children who experience an inability to protect themselves or who lack protection from others to avoid the consequences of trauma may also feel overwhelmed by the intensity of physical and emotional response. Now, importantly, even though adults work hard to keep children safe, dangerous events still happen. This danger can come from outside the family, such as a natural disaster, car accident, shooting, or from within the family, such as domestic violence, physical or sexual abuse, or the unexpected death of a loved one. So when, again, putting this all in context for immigrant children or for Latino children who may be living in new homes if they've recently migrated or living with a relative, all of these things have to be kind of assessed and are very important for you as frontline workers to take a look at these issues with the kids that you're working with and the families. Next slide. So what might be traumatic for youth? Again, physical, sexual, or psychological abuse, including trafficking, family or community violence, sudden or violent loss of a loved one, substance use disorder, especially in a family member, can be very traumatic. Refugee and war experiences, including torture, serious accidents or life-threatening illness, military family-related stressors, deployment or parental loss, or when children have been in situations where they feared for their lives, when they believed they would be injured, witnessed violence, or tragically lost a loved one. They may also show signs of traumatic stress. Again, within the context of immigration, for those of you that are working with traumatized or unaccompanied minors, children that have come across the border with a non-family member, or children that might have been brought across by coyotes. These children are more than likely traumatized. Next slide. So what are the reactions that children have to traumatic stress? Children who suffer from childhood traumatic stress, in other words, they've been exposed to one or more traumas over the course of their lives, they develop reactions that persist and affect their daily lives after the event has ended. Traumatic reactions can include intense and ongoing emotional upset, depressive symptoms or anxiety, behavioral changes, difficulties with self-regulation, problems relating to others or forming attachments, regression or loss of previously acquired skills, attention and academic difficulties, nightmares, sleeping difficulties, and eating or physical symptoms such as aches and pains. That's very important because a lot of times kids tend to express their emotional pain through physical complaints. So you see a lot of headaches, stomach aches, sleeping problems, those kinds of issues or symptoms. When you see that a lot in children, it may be an indication of they're reacting to trauma. Other children, I put this in bold, other children may use drugs or alcohol. They may behave in risky ways or engage in unhealthy sexual activity. That's all, considered a reaction to their experiencing trauma, right? That's the lowered self-regulation, more risk-taking. So children who suffer from traumatic stress often have these kinds of symptoms when reminded in some way or another of the traumatic event. So that's something that, and again, we're not going to go into the treatments of traumatic stress, but for you frontline workers, very important that you recognize that many of our Latino kids, especially immigrant children, may have been exposed to multiple stressors and have developed some traumatic reactions. Next slide. So very important topic, which we've kind of covered, is complex trauma. So complex trauma describes both children's exposure to multiple traumatic events, often invasive or an interpersonal nature, and the wide-ranging long-term effects of this exposure. These events are severe and pervasive, such as abuse or profound neglect. I like to throw in here, exposure to chronic racism, discrimination. Those are also certainly fit the bill for complex trauma. These complex trauma syndromes often occur early in life and can disrupt many aspects of the child's development and the formation of a sense of self and interfere with the child's ability to form a secure attachment. In other words, when children are traumatized, and I've seen this a lot working with kids, they may have had a trauma, a very traumatic year, say the third grade year or the fourth grade year. And upon testing, when we do psychological testing, it's interesting because all of the things that they should have learned in the fourth grade, they didn't acquire that knowledge or those skills. It was kind of like a lost year for those children. So when children are traumatized and constantly re-experiencing the trauma or the pain, they tend to not be able to, attend to other things like learning. Very important. The National Childhood Traumatic Stress Network offers multiple fact sheets and core information for various evidence-based practices also to treat childhood trauma. So again, please go to the NCTSN network website where you'll find multiple types of EBPs designed specifically as trauma-informed care for kids. Next slide. Now, we've been talking about rather extreme forms of childhood stress and trauma, but a lot of kids also experience other kind of day-to-day stress, especially our immigrant kids or other Latino kids, and they begin to express other kinds of lower levels, what I call lower levels of behavioral problems. Very specifically, within the DSM criteria is something called an adjustment disorder. An adjustment disorder is an emotional or behavioral reaction or symptoms that develop in response to an identifiable stressor or stressors within 3 months of the event. So if you think about a child who's fairly well adjusted, but then something happens to them, severe stress or a traumatic event, they may also develop lower level symptoms of conduct or emotion. Now, these symptoms will last no longer than 6 months once the stress has dissipated or related problems have been resolved. In other words, when we help kids cope, put some effective coping in place, do some intervention with the family, we address the stressor, that tends to help resolve this adjustment disorder. So again, a complex trauma is pretty severe. Adjustment disorders are less severe, but they all caused by exposure to stress. The last bullet, I'm not going to go into syndemic stressors, but these are stressors that are chronic and compounding, and they're kind of like clusters of stress. There's a new research related to syndemic stressors, and unfortunately, we don't have time to go a lot into this. Next slide. So in our work, and I'm going to talk a little bit about our work in working with kids in a drug prevention a model program. But a lot of the kids that we see have the following kinds of behavioral problems: fighting or being overly aggressive at home or at school, constantly disobeying rules, right? Drug or tobacco experimentation, including e-cigarettes, lower level delinquency like stealing or shoplifting, low level gang involvement, associating with negative peer groups, and acting out through social media like bullying on social media. So we see this a lot in kids, as young as 5 and up to 17. This is sort of on the behavioral side. Next slide. On the emotional side, we see children who have sort of symptoms related. They get withdrawn, very isolated. They may have lack of energy, no interest in friendships, or they lose interest in friendships. They have a change in their school grades, their attendance, frequently crying, frequent physical complaints. I mentioned that to you earlier. Irritability, nervousness, they may be fearful, nail biting, sleeping difficulties, or worrisome. They're worried about social media and how they're going to be perceived on social media. They're worried. They're kind of obsessed or very concerned about what people are saying to them on social media. So again, we see this in the lower level. We see these kinds of symptoms in kids that are at risk for substance use. In our program called Familia Adelante, which I'm going to talk to you very briefly about today, we try to screen kids into our program based on those behavioral or emotional problems. Again, ours is more of an early prevention program, early intervention program. It is not a treatment program for complex or severe traumatic exposure for kids. Next slide. So we've been doing a lot of research over the last 10 years or so, and we've identified some important areas of cultural stress for our kids, for Hispanic kids. And these include the following, the bulleted items there. These are things that kids have reported in a large national study that we did in LA, Miami, Boston, and El Paso, Texas. Over close to 2,000 kids in our sample. And this is what they told us, and this is what kind of came out of that research, that kids are exposed to family economic stress, acculturation gaps, as I mentioned to you, the problems between parents wanting the kids to be more traditional Mexicano and the kids wanting to be more Americanized. We see this a lot. Cultural conflicts in the school, immigration stress, discrimination stress, family-related immigration stress, community and gang violence, and family drug-related stress. That's when a family member is using or has legal problems associated with stress. So we see this in a large sample of Latino kids, 12 and up. Next slide. If we look at those different types of stress, this will give you an idea of some of the questions that we've included in one of our stress surveys called the Hispanic Stress Inventory for Adolescents. So when we talk about acculturation gap stress, here's a sample. My parents want me to maintain customs and traditions from our home country. If they mark yes to that and other questions like that, then we say they would have high levels of stress in that area. Culture and educational stress. Teachers think I'm cheating when I speak Spanish. Again, we see other things like this in the school where schools don't celebrate Latino holidays. There's no respect for our culture in those schools. There may be discrimination and et cetera. Immigration-related stress. I had to leave family members behind in my home country. Community and gang-related stress. There was a lot of pressure for me to get involved in gangs. And again, there are many other questions like that. Discrimination stress. Students made racist comments about me. Family and drug-related stress. A family member had a drug problem, and family immigration stress. Family members were afraid of getting caught by immigration officials. And then the economic stress items, my family had problems paying the rent. So again, within the Hispanic Stress Inventory for kids, we give this test, we do an assessment, we find out if they're high, medium, or low on these stress items, and we work with them on these issues. Next slide. So I thought this was kind of a way to think about migration and stress. So it's not just the stress associated with being in this country, but there's a lot of pre-migration stress that kids can experience. They can have been exposed to extreme poverty and violence in their home country. And then there are things that a colleague of mine, Dr. Luis Zayas, calls in-transit stressors. These are family separations during the migration process or in-transit extreme environments. I put in extreme environments. That can mean, no water, no food, witnessing, some horrific events. That can all occur within transit. So we need to do that kind of, again, assess the pre-migration stress, the in-transit stress, and then post-migration are the ones that I just showed you the slide on. Cultural language, discrimination, family, school, acculturation gaps, those kinds of things. The point being is these things accumulate. These stressors, if we don't address them, if we don't let kids talk about them and sort of process these things, they can accumulate and they can really raise the risk for substance abuse. Next slide. So it's important not just to talk about stress, but also talk about resilience, right? Because what we're trying to do and what you all try to do is we try to build resilient children. We try to build resilient families, caregivers. So despite the challenges that Latino immigrant families encounter in the US, including, again, racism, xenophobia, work, socioeconomic conditions, and low insurance coverage, all of those things, Latino immigrants tend to be fairly resilient. Now, resilience is the ability of an individual to resist, rebound, or recover from challenges in life, right? Resilience can also be defined as positive adaptations that are made after immigrating to the US and factors that buffer against acculturative stress and stem from individual, family, community, and societal domains. All of you have had to be resilient in getting through the last 2 years of the pandemic. Some of us still have some scars. Some of us got ill. Some of us lost family members. But the fact that you're on this webinar and you're still doing your work tells me that you are resilient. You have been able to adapt to those stressors, and you hopefully have come out of it with new skills, with different skills, with a different understanding about your life and about health and about your families. Next slide. I'm not going to go a lot into this. This is our recent study that we're doing, and basically we're finding 3 areas or 3 levels of resilience. That's resilience at the individual level. And one of the things I wanted to point out is optimism. Our immigrant families show that they have a lot of optimism and hope about making it here, about living that American dream. That's one area. Then we have family and interpersonal strengths. There's a strong sense of familismo, parental monitoring, positive parent-child communication, and trying to maintain a strong family orientation. So family resilience is very much present in the immigrant studies that we've done. And then finally, there's community level strengths, strong social networks, strong social and health access to services. In many communities, there are interventions that promote health equity, drug prevention. We just have to find them. We have to, as advocates for our families, find those programs and link our kids and families to those kinds of programs. So these are 3 areas of resilience that we're finding that seem to buffer the impact of acculturative and immigration stress. Next slide. In one study, we also went and actually interviewed many parents, and they talked to us about the kinds of strategies that they use to overcome stress. Let's go to the next slide. I've listed these in this presentation. I don't think we have enough time to get to these, but there are a number of things that families and adults tell us they do when they experience discrimination. For example, the last bullet, finding resources and getting legal help and voting for measures and laws that benefit immigrants. Next slide. Again, we're going to make sure that you get all these so you can, the idea is that we want you to promote these kinds of resilience factors. We want you to mobilize these things in the families that you're working with. You can see from marital problems, learning from others, asking advice, seeking assistance from the clergy, for parenting stress, seeking help from extended family, aunts, uncles, etc. Next slide. For immigration stress, becoming more educated on topics of immigration, taking ESL and gathering information and resources on American culture. These were all very helpful comments that folks told us they do to kind of deal with, again, acculturation issues. Next slide. For family conflicts, folks told us that they, seek support from other family members. Spiritually, they try to get guidance and help from God and the clergy, and they try to increase communication skills with their families. Next slide. For health-related stress, folks tell us they do a whole bunch of different things, including seeking traditional remedies, treating yourself, getting advice from a pharmacist, getting help from pharmacies that have meds from other countries, that is like going to Mexico, and et cetera. Again, we'll send these slides to you. We want you to use these suggestions in the work that you're doing. Next slide. And there are other family resilience sort of factors that we don't want you to forget about. Familismo, trying to build familismo, respeto, compadrazgo, orgullo. Cultural pride is very important. Helping people rely on spirituality, real important. Extended family support systems, helping people develop strong cultural traditions, maintaining cultural traditions, values, and customs, very important. Education, becoming bicultural, bilingual, really important. And then the immigrant optimism. So these are other just kind of, and we've touched on many of these before, but these are resilience factors that can, again, offset or reduce the impact of stress. Next slide. We've been working to develop, well, we actually developed a program to address many of these stress and resiliency factors called Familia Adelante. It's a 12-week program. Let's go to the next slide. It's a 12-week program that's been, that we use with kids, again, ages 10 to 15, those kids that have been referred to us for those behavioral or emotional problems and that are at risk for substance use. In this program has been studied and published. We've found that our program helps reduce past 30-day drug use. It increases perceptions of harm regarding alcohol and other drug use. It has resulted in reduced conduct problems in kids, reduced learning problems, reduced hyperactivity, reduced anxiety. And for the parents, we've shown improved knowledge about drugs and knowledge about HIV. Again, this is Familia Adelante. Next slide. This is just a conceptual framework for our Familia Adelante program. Again, you can study this in more detail. Next slide. Recently, a statewide evaluation. Our program is being used in the Tucson, in many of the schools in Tucson, and now along the border in Arizona. An evaluation was done by the Arizona Parents Commission out of the governor's office. Next slide. And found on average, the participants reported 99% satisfaction of the program. 100% of the parents stated they would recommend the program to others. Based on their study of 161 kids recently that went through our program, they found improved family cohesion, improved attitudes towards use of substances, improved youth knowledge about the risks and harms of alcohol and substance use, improved parent-child communication, and improved parental involvement in their children's activities. Next slide. This is the slide that's basically showing the same thing I just mentioned to you. For the Familia Adelante drug prevention program. Next slide. With Familia Adelante, we try to, again, identify those risk factors for kids, those especially the cultural risks, as well as for the parents. So the kids go through their 12 weeks. It's a group format, and the parents go through their program 12-week format. And we're basically trying to help them identify and articulate the sources of cultural stress that they have in their lives, including immigration stress, pre-migration, in-transit stress, to talk about those things and then to help them deal with ways to more effectively cope with those. This was just some data showing, next slide, that the program worked especially well with our immigrant parents. The slide on the left, the 3 bars on the left, show that there was a pretty significant reduction in acculturation stress, especially in our immigrant, where the parents and the child were both born outside of the country. Next slide. I'm kind of rushing now because I know we want to save time for Q&A. Same kind of situation here with perceived harm from substance use. Again, that seemed to be most pronounced in our immigrant families. And next slide. This is just kind of a summary of what we talk about in our program. These are some things that you may, some takeaways for you when you go back and look at the slideshow. But for example, session 4, we talk about stress. What is stress? How does it affect us physically and emotionally? Session 5, we deal just with acculturation stress. And there are many, many activities and role playing within each of these lessons that we administer. Next slide. Again, There's a gang prevention, a lesson 9, lesson 10, substance abuse education. In addition to family stress, we also have a family communication lesson on week 11. And so this is, again, this is a sort of an example of how one program, and again, there are many of these, but not many for Latino families, but there are many of these out there that help address some of the risk and protective factors that kids experience and try to keep them away from substances. Next slide. So that brings us to, I know I've gone through these slides pretty quick, but in summary, and thank you for your attention here. Pre-migration, in transit, and post-migration stress impact Latino youth and can raise the risk for substance and alcohol use. Again, pre-migration, in transit, and post-migration stressors impact Latino youth and can raise the risk for substance and alcohol use. Child health care workers should assess and identify sources of trauma and acculturative stress, as well as symptoms related to PTSD and adjustment disorders. If we can identify these things early, we have a chance of keeping kids out of the drug use environment. The third bullet, drug prevention programs that help develop youth and family resilience and coping are effective, even for immigrant youth. And I showed you as an example with our Familia Adelante program. And finally, highly traumatized youth may require more intensive trauma-focused, trauma-informed care. So they may be beyond drug prevention programming and may need more individualized trauma-related care. Next slide. So that brings us to our Q&A, and I'm going to turn it back over to our staff to kind of help guide me through the Q&A. I think that's Christina or Ana.
That'd be me, Dr. Cervantes. Thank you so much for that wonderful presentation. I do see some questions here in the chat. We'll start with those. And I know we also have like 3 questions in Q&A, but someone is asking, Zachariah is asking, is culture-active stress the same as culture shock?
Basically, yes. That's like an old term that was used where you have an individual coming from one culture and having to deal with, a new culture, language, traditions, customs, a new belief system, and new ways of doing things. Yes, it is very similar to culture shock.
The next question is, how do these numbers compare to Latino youth in their native country?
My understanding is that drug use rates for example, in Mexico are very, very low among youth and adults in general. Much lower drug use rates in other countries than we have here. I don't have the figures exactly at my fingertips, but there are many studies that have shown that. Okay.
The next question, Debbie is asking, she says, I believe the research behind over-acculturation potentially being a risk factor. Can you dive into more why?
Right, and we talked about those things in the presentation, that acculturation stress, so it's the stress associated with acculturation, making a lot of changes or being exposed to discrimination or having language problems. All of those things can raise the risk for substance use, either through self-medication or a way to kind of cope. You know, people use that as a way to cope with the stress that they're having.
Thank you. The next question is from Diana Monroe. She wants to know, what are some of the psychotherapy approaches that you would recommend, like CBT, conflict resolution therapy, etc.?
Again, as I had noted, there are evidence-based programs and treatments that are specifically for trauma-informed care. And I know in the next learning series, there's going to be more discussion about early screening. But if you go to that National Childhood Traumatic Stress Network website that is part of the Department of Health and Human Services, I can maybe put that, let's see if anybody can find that really fast, and maybe we'll put it in the chat box. But that's what I would recommend. They actually have a toolkit for you to find the programs. There are also, the National Latino Behavioral Health Association has an EBP, an evidence-based practices compendium. It's an electric compendium. So Anna, you may want to post that in the chat box as well.
Okay, we can go ahead and do that. The next question says, are there trainings offered for Familia Adelante to become facilitators?
There are trainings, and if you're interested in Familia Adelante, you can contact me directly. And I don't know, are we going to put my email address here, or
Yes,
how
sir.
you want to do that?
Yes,
So,
we have that in one of the next slides.
okay.
Okay, and let me see. I'm trying to see if we have any more questions in the chat. We do have some questions here in the Q&A. Marcela is asking, is there any research about the use of sacred medicine, ayahuasca and yage, as an approach to heal mental health issues among Hispanic and Latinos?
There absolutely are, and I'm going to refer you back to Anna, because I know we have done, through the addiction, the National Hispanic Latino ATTC, we have done workshops and a workshop series on traditional healing. And so that's not my expertise, but I know there certainly are experts in our network, in the ATTC network, that have that information. And I would say, in general, yes, there are ways that where traditional medicine is, traditional healing is used. Drumming, I know, is used a lot. Other kinds of healing techniques that are ancient and that are very effective for mental health issues.
Okay, and the next question is, how can we get Latinos to access and maintain behavioral health services?
Can you repeat that? How can we
get Latinos to access and maintain behavioral health services?
I like that question, because as frontline workers, those of you that are in the field, you really have to do your homework and become almost like a clearinghouse yourself for what's available in your local community regarding low cost or low fee or no fee health or behavioral health services. There are many other legal avenues, especially for unaccompanied minors, to receive those kinds of treatment services. But you really have to know about what's there in your local community or the community that you're working with. Who are the players? Who are the people that are doing that kind of work? Develop your resource list, develop your linkages so that you then can make those referrals to organizations that specifically work with underserved Latino clients, including parents and children and other family members. Catholic Charities is a wonderful resource that's located in many communities that have or can access or have linkages to mental health and or general health care. But there's also another part to this, and that has to do with stigma. For those of you that work with Latino, especially both children and adolescents and parents or adults, mental illness is still highly stigmatized in our community. There's a lot of people that don't believe in mental health care, or they believe that if you have a mental health issue, you go see a psychiatrist or a psychologist, or you talk about your problems, that somehow means that you are loco and you're very crazy, right? So we have to kind of sometimes we have to pitch mental health, but not as mental health. We have to talk about it as well-being, as taking care of your family, and not talk about it as we're going to treat your mental illness. So it's really about the way we present our programs, and how we work with adults, especially caregivers, and sort of the whole issue of familismo and maintaining family health is maybe a better way to talk about getting in or helping people get into mental health care or their children in mental health care. We've had a lot of parents that did not want their kids to be in, for example, Familia Adelante. They got referred, but they didn't want to have their children served. And oftentimes, after a conversation with the parent, the hesitant parent, and explaining that, hey, this is for your child's sake. This is for your family's well-being. It doesn't mean that your child is schizophrenic or has psychosis. It just means that they're having some adjustment problems. And to kind of downplay and educate mental health care, substance abuse care, so that it's more palatable for Latinos. I think it's challenging for us, but it's very important. We've got to deal with the stigma.
Great. Thank you for that, Dr. Cervantes. The next question comes from Stara. She says, would love to hear your perspective on some best practices for providing psychoeducation to parents, caregivers of immigrant youth regarding substance use prevention, any special considerations, approaches, etc.
Yeah, I think that when you get the slide deck, if you go to our Familia Adelante, the sample sessions, we try to follow the same kind of lesson plan, even for parents. So if you can, and also in the slide deck, we've shown you areas of acculturative stress that are important for kids. If you can address those when you work with your parents, help them identify those, or what I say, normalize those things, that hey, your family is not the only immigrant family that's struggling with this. Many immigrant families struggle with language difficulties. Many struggle with, many of our families struggle with, cultural changes or being away from your family in your home country, right? Having them talk about those things that are the things that are important within immigration stress, or even if they've had, like I said, pre-migration problems or issues, living in very, impoverished communities in El Salvador or Mexico, or witnessing a lot of gang violence in those countries. Those things have to be talked about and resolved. So traditional mental health care, we don't do that, but in Latino behavioral health, We have to do those things. We've got to address those. So take a look at the sample, those sessions that I listed in our PowerPoint for the kids, and you can kind of at least get an idea of what some of those topics are and some of the things that you should address with the caregivers. And again, as I mentioned, if you really want more information, send me an email and we can talk more about Familia Adelante, because there is an entire 12-week lesson plan for them as well.
Great. Thank you for that response, Dr. Cervantes. And I have one last question. Angela wants to know if you would be able to speak about the difference between this curriculum you reference and the Strengthening Family Programs model.
I'm fairly familiar with Strengthening Families. I know it was developed by Dr. Carol Comfort at the University of Utah and tested. It is a strong evidence-based practice for substance abuse issues. It unfortunately does not cover a lot of the acculturative stress issues that we believe are important to cover. And again, in the slide deck, you remember I showed you there were about 8 different areas of stressors that are culturally specific to Latino kids. Those have to be addressed. We can no longer afford to ignore the fact that, you know, Latinos, especially immigrants, have experiences that are very different than mainstream Americans. Most Americans have never even been outside the country, much less gone through an immigration experience. They've never had that. Most kids have never had to adjust to a new country. A lot of kids, mainstream kids have gone to new schools. They've had to move from one town to another, but they've never actually moved into a new country. And so we have, as mental health professionals, as behavioral health professionals, we've got to begin to address these things as part of our day-to-day treatments or counseling approaches with our families.
Thank you, Dr. Cervantes. And we got a couple more questions here. It says, could this information be adapted in some way to Latino religious beliefs?
Yes, I believe that a lot of what you might call traditional, for example, religious virtues, if you want to call them that, like are part of, any healthy coping sort of strategy. And the emphasis on familismo is certainly consistent with, spiritual or faith-based teachings. So I think, yes, absolutely. There's a lot of overlap.
Right. And Norma is asking, I feel immigrational trauma is still very much foreign in our communities and plays a big part in the mental health issues of immigrant families. What is your perspective?
Well, I think you answered your own question. Immigration-related stress is a driver. It's a key driver of substance abuse, substance use, and mental health issues in our community. And if we do not address these things in our programs, we're missing half of the key issues that people are coming in with. It's like, in old traditional psychotherapy, it's like, how do they say, as you take the onions, you cut an onion and unwrap the onion, right? Eventually you get to the core issue. What we're saying in Latino behavioral health is that immigration-related stress, acculturation stress, acculturation gaps within the family, all of those are key mental health issues for our families, and they have to be addressed. We have to help families deal with ways to cope with those things.
Thank you so much, Dr. Cervantes. I think we've answered all the questions that we had, either in the chat or in Q&A. Can we go to the next slide, please? I know a lot of people have been asking about your contact information, and here is Dr. Cervantes' email. If anyone wants to contact him or needs additional information about Familia Adelante, you may go ahead and do that. Next slide, please. We would like to ask that you please take 5 minutes of your time and your busy schedules to complete this survey. Again, your opinion is very important to us, and it helps us improve and make these types of trainings that we do better. Next slide. We want to invite you to join our second session on Thursday, January 12th at 2 p.m. Eastern Time, 12 p.m. Mountain Time, so we can continue this conversation about substance use among immigrant youth. Please share this link with your family, friends, and contacts so that they can join as well. The link, again, is being shared in the chat. Next slide, please. For more information about the National Hispanic and Latino ATTC and PTTC, ATTC, or to request training and technical assistance, you can reach us. Here's the contact information here. Next slide. If also we're sharing the information for the PTTC as well. And again, you will be you can get a copy of this. You will be getting a copy of this slide deck. So don't worry too much, I guess, about writing the contact information. You will have access to that. Next slide. Thank you so much. Gracias. Obrigado. We really appreciate you taking time from your busy schedule. Again, if you can please take time and complete our evaluation survey. Again, your opinion is very valuable to us. And thank you all. Muchas gracias por acompañarnos este día. Apreciamos mucho su presencia. Thank you. And we hope to see you on January 12th. Have a great rest of your day.
Thank you very much for your
everyone.
participation, everybody.